Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. Well, there have definitely been strides when it comes to prostate cancer care over the years. However, the racial disparities there still exist. Between Black and Hispanic men in particular, there is a high burden of prostate cancer mortality. And joining us to discuss this more, we're excited to welcome back Dr. Brian K. McNeil. He's the Associate Dean for Clinical Affairs, Vice Chair, Department of Urology at SUNY Downstate Health Sciences University. We're going to talk to him not only about what we need to know about the disparities, but also how COVID-19 has really impacted this and where you all can get more information as well. Dr. McNeil, thank you so much for the time. Really appreciate it.
Hey, it's a pleasure to be here, Cyrus, and good morning to your audience.
Well, look, I appreciate this information. And you know, one of the things we've heard, especially over the past year and a half, Dr. McNeil, is how much COVID, the pandemic, has really kind of brought these disparities to light. But when you kind of think about the research that's been discovered, I mean, what has it been like for you to look at how these racial disparities among men with prostate cancer still persist?
It's been shocking, it's been scary, and it's a reminder that although we've come a long way, we have a long way to go, especially when you consider what has been revealed by the coronavirus pandemic.
And I think that's why this conversation is so important. Is there racial disparity, Dr. McNeil, in the utilization of new therapies, though, when it comes to advanced prostate cancer?
There absolutely is, and we don't quite understand why that's been the case. There was some research that was discussed at our annual meeting, which just concluded yesterday, by the way, which revealed that some new prostate cancer therapies that have been introduced haven't been utilized in all communities equally. So when you think of white men of European descent, they've had greater access to certain treatments compared to African American men, especially those in urban areas.
Dr. McNeil, I mentioned, and you also referenced the pandemic, but also, and I've been hearing about it here in Mississippi, have you found that also that certain areas of states also have kind of been impacted by the way that there are treatment options available for them?
Absolutely. So if you think about it, going into the pandemic, Black men and white men, they had access to care for treatment of prostate cancer. But what we found is that in urban areas where healthcare resources were shifted to the coronavirus pandemic, Black men weren't having surgery as much as their white counterparts were. So you have a situation where the coronavirus pandemic has exaggerated disparities that existed prior.
And since we're talking about prostate cancer, of course, there are some people, and over the years, I've even heard it myself, Dr. McNeil, where people say that you don't need to worry about getting tested to a certain age. Have you found that to still be the case? When should men start being screened for prostate cancer?
Right. So with regards to screening, that's a bit of a nuanced conversation. What we recommend at the American Urological Association is that if you're between the ages of 55 and 69, you should have a discussion with your healthcare provider about whether or not you should get screened. We call it shared decision-making because it's a decision that you make with your doctor. If you have a family history of prostate cancer, if you're African American, or if there are other cancers like breast cancer that run in your family, you might want to get screened at an earlier age than 55.
Got you. So it's great to know. That's why those conversations with our doctor are so important, which is why we're glad that so many people are taking advantage of now either telehealth if they're not comfortable going into the doctor's office, but definitely being in communication with their physician is so important. Dr. McNeil, you once again have brought us some great information. Dr. Brian K. McNeil has been our guest, talking with us not only about the disparities that might exist when it comes to treating prostate cancer, but also why that seems to be the case. Where can our audience go for more information, Dr. McNeil?
Sure. Please go to this website, urologyhealth.org. I repeat, urologyhealth.org. There's lots of great information there.
All right. Dr. McNeil, thank you so much for this valuable information and the work that you're doing, and looking forward to having you back on the program again.
I look forward to it, Cyrus. Have a good one.
You as well. Thank you. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.